With us today is Dr. Deena Hinshaw, Chief Medical Officer of Health for Alberta. Also with us and available to answer questions as needed is Dr. Mark Jaffe, AHS Vice President and Medical Director for Northern Alberta. As always, Dr. Hinshaw's expertise is on Alberta's public health response, so she's happy, obviously, to answer any questions you have about that. If there are other questions, particularly of announcements or other things that have happened today, just let us know and we can connect you with the right individual. I will now turn it over to Dr. Deena Hinshaw.
Thank you, Tom. Good afternoon, and thank you for coming today. As I previously shared yesterday, as you know, I was tested for COVID-19, and I'm pleased to let you know that my test results were negative and that I am feeling better this morning. So I'm pleased to be back with you in person for today's update. Over the last 24 hours, we have confirmed 23 new cases of COVID-19, bringing the provincial total to 97, up from 74. As I reported yesterday, we now have confirmed cases in every health zone in Alberta. Currently, 5 cases are hospitalized, of which 2 were admitted to the ICU. These are the same numbers as previously reported. All other confirmed cases are self-isolating at home and are expected to make a full recovery. As was announced by Premier Kenney earlier this afternoon, we are taking aggressive new measures in an effort to reduce the spread of COVID-19. The Government of Alberta is finalizing the signing of a state of public health emergency, empowering authorities under the Public Health Act to respond to the COVID-19 pandemic. New public health measures under this state of emergency will limit the time Albertans spend in large crowds and crowded spaces. Effective immediately, mass gatherings are limited to no more than 50 people. This is inclusive of places of worship, funerals, and weddings, where Albertans must ensure appropriate social distancing and other sanitization practices. Grocery stores, shopping centres, healthcare facilities, airports, and other essential services are not included. Any other organized gatherings of more than 50 people must be cancelled immediately. All Albertans are prohibited from attending public recreational facilities and private entertainment facilities, including casinos, racing entertainment centres, and bingo halls. They should also not attend all recreational facilities, gyms, arenas, science centres, museums, art galleries, community centres, fitness centres, swimming pools, and libraries. This prohibition also extends to attending bars and nightclubs where minors are prohibited by law. Today on St. Patrick's Day, I know this will disappoint many, but we must take action to limit the amount of time Albertans are spending in crowded spaces. Sit-down restaurants, cafes, coffee shops, food courts, and other food-serving facilities, including those with a minor's allowed liquor license, are limited to 50% capacity to a maximum of 50 people. At this time, not-for-profit community kitchens, soup kitchens, and religious kitchens are exempt, but sanitization practices are expected to be in place, and support will be in place for this practice. Food services and work camps are also exempt, but in addition to appropriate sanitization practices, arrangements should be made to provide for workers in camps should they need to be self-isolated. These are aggressive steps that we do not take lightly, but these are necessary to keep us all healthy and safe. The only means we have to prevent the virus from spreading is to limit contact between people. The more we can slow the spread of the virus down, the less likely it is that there will be a surge of cases that overwhelm our health system's capacity to care for those who need hospitalization or intensive care. You may have heard this described as flattening the curve. This is why we are taking these measures. In addition, the healthcare system is preparing for any increase in the number of cases that need hospital care. Alberta Health Services is postponing all scheduled and elective surgeries. Urgent and emergency surgery, as well as oncology and scheduled cesarean procedures, will continue. AHS will be contacting Albertans scheduled for procedures and will reschedule as soon as possible. We do not have a timeline for this due to the ongoing pandemic. We understand that many of you will be anxious to hear from AHS about your surgery. We ask for your ongoing patience. please do not call 811 or the clinic. You will be called by AHS. This decision will have an impact on those waiting for elective or non-urgent procedures, but it is a necessary step to ensure the health system can sustain its pandemic response and be able to respond to emergencies. Frontline teams will be redeployed to other areas of the healthcare system to meet demand and ease pressure points. I understand the tremendous impact all of these measures will have on all of us. We will get through this together, but we need your help and support by following these orders and all other public health guidance. I cannot stress this enough. We must all take measures to improve sanitization and cleanliness. Regardless of where you are or what you do, we all have a responsibility to prevent the spread of this virus. Even though it may seem simple, practicing good hygiene habits, such as washing your hands with soap and water for 20 seconds, and covering coughs and sneezes will help stop the spread of COVID-19. Critically, and most importantly, if you don't feel well, stay home and self-isolate. I am also advising all Albertans to take all appropriate steps to socially distance themselves from others during their day-to-day lives. All measures, however small they may seem, play an important part in reducing the risk for all Albertans. Try to avoid overcrowding on elevators, for example. Stay 2 meters away from others when possible. In the weeks to come, we will all need to be mindful of each other and take these crucial steps to protect ourselves, our loved ones, and our communities. The measures introduced today will be hard on all of us, but I believe we are ready and able to rise to the challenge before us. Albertans' health is and will always be our top priority. Thank you again, and I'm happy to take any questions.
Dean, says Bruce.
2 questions, if I may. First, did you say, was this decision the public health emergency made on your recommendation? I assume it was.
Yes, that's right. I made a recommendation that we should move to that measure.
And what happened in the last 24 hours that made you decide, yeah, today's the day we need to do this?
So,
Is there a tipping point?
So I think one of the critical things, I talked before about some of the community-acquired cases we'd seen, and we have seen a few more cases that we're still investigating, but that are concerning. I anticipate having more information tomorrow to share about those, but it does seem to me that we are seeing a few more instances where community transmission is possible. In addition, we're seeing examples such as the dental conference that I've referenced before, and we now have 6 cases in Alberta alone from that one dental conference. So we are trying to get the word out about instances like that. But I think when we see examples like that one conference where just in our province we've seen many cases, or the single gathering in one home that has now 10 cases associated with just one gathering, to me these are indications that we need to take these steps to be ready for what I believe may come in the next several weeks. And so I believe the time is right to really set us up for success, because I think if we wait until we're overwhelmed and then declare, it's a little late when we could do it proactively and get ourselves set up.
Can I ask you then just about the 97 feet, because so we've gone in 12 days, we've gone from 1 to 97. Can you contextualize that at all, compared with other jurisdictions and stuff? Yeah. Is that less than you would forecast, or how are we doing based on the 97 number?
So I think the 97 number is an example of, in some ways, the success of our actions. The vast majority of those still are either confirmed related to travel or a close contact of a case. So it shows that we're putting those measures in place to contain spread and detecting cases that come in. But what I think we all need to be prepared for is that we're fighting a war on 2 fronts. We need to continue to detect travel-related cases that are coming into the province, and we will continue to see those as spread is occurring around the world. And as the Government of Canada has recommended that Canadians come home, we anticipate we will see people coming home, entering self-isolation in order to prevent spread to others, but we will likely see additional cases in that group. In addition, we now see a few of these cases that we seem to have had acquired in the community, and so that's the other front that we really need to focus on, and again, where we pay attention to expanding access to testing through selective measures. Again, we can't test every Albertan, but that's where we need to be really focused. And so at the moment, our community-acquired cases, the total number is very small. So I think that's a good thing for the moment. But again, what we need to do now is raise our efforts to prevent more community transmission. And so I think that's, to put the numbers in context, even though we've had quite a big jump, many of those are related to the previous cases that came in, and we're seeing spread around those within some households or, again, some of these clusters related to single group exposures.
First question for Dr. Hinshaw. Second question I think will be for Dr. Joffe. We're hearing about patients who are lying about their symptoms or travel history to either see a doctor or get tested. Have you heard about this, and what are your thoughts on it?
So that hasn't been reported to me before, and I do know that Albertans are concerned, those Albertans who haven't traveled are concerned about not being able to be tested. So I understand that is a frustration, and that could be why some people are choosing to respond in a way that's maybe different from the facts when they're going through the assessment. What I would recommend is that if Albertans are worried if their minor symptoms are related to COVID-19, that again, they don't need to have a test result to be able to stay at home, self-isolate away from others. And if someone has really mild symptoms and they take those measures, they stay at home, away from others, self-isolate for 14 days from the start of their sickness, they're not a danger to anyone else. And if their symptoms are mild, then they'll get better on their own and they won't need any care. Any Albertan who starts to feel more unwell, who needs advanced care, needs hospital care, will absolutely be tested if their symptoms warrant it. But anyone with those really mild symptoms, if they're able to stay home, stay away from others, a test is not needed to be able to take appropriate measures.
Oh, sorry, follow-up? Yes.
Yeah. You were talking about how elective surgeries, non-urgent surgeries will be postponed. How much more capacity do you expect that to create, be it related to beds or in terms of frontline workers?
So thank you for the question. We are doing a considerable amount of planning, and over the last couple of days have looked at the number of beds, the number of spaces that we may need in order to provide care. And in working through those numbers, it became apparent that we need to start ramping down some of the activities that we typically do, that would include elective surgeries, so that we can get people healthier in the hospital, get them home to recover, and free up space in our facilities so that we are ready for increasing numbers of COVID-19, which is what we fully anticipate. So we're focused on three things. First of all, creating space in order to provide care. Secondly, ensuring that we have the equipment to provide the care. And thirdly, and most importantly, ensuring that we will have sufficient staff, sufficient trained staff that are prepared to assist Albertans in their time of need.
And so just quickly to follow up on that, what was the tipping point for that? Because we asked you that question yesterday and you said no decision has been made.
So it's been an ongoing discussion, and let me just say thank you to all of the incredible women and men who work for Alberta Health Services, who are working literally 24/7 in preparation for COVID-19. They have been working really for the last 2 months and ramped up more recently as we've begun to see cases. So this has been an ongoing day-by-day discussion, day-by-day work as we look at what we think the needs will be and as we prepare to be able to provide the care that Albertans will need.
Excellent. So we're going to go to the phone. I know there's a couple others will come back. Operator, could you patch through the first question?
Our first question comes from Sammy Huss of Postmedia. Your line is open.
Hi, Dr. Hinshaw. I haven't seen the breakdown of the new numbers today, obviously, but as of yesterday, about 70% of the cases in Alberta were in the Calgary zone. Can you offer any reasons why that would be?
So we know that Calgary zone tends to have more international travel returning to that particular location than other zones. So that's one possibility. Again, in Calgary and in Edmonton, the majority of cases are travel related. So we believe that's one of the reasons why that zone has a higher number than Edmonton.
Excellent. And could we put that to another next question, please, operator?
Our next question comes from Jason Herring of the Calgary Herald. Your line is open.
Hey there, two questions. The first, Dr. Hinshaw, I'm wondering at what point will we know if these measures that we're seeing introduced in the last week are actually working?
So what we would expect to happen is because the measures that we're putting into place now we likely would see their effect within about 2 weeks because the incubation period of this virus extends to 2 weeks. So again, given that we know that there's some community transmission occurring, we would expect to see our numbers continue to rise over the coming days. We would expect that that may then be sustained, throughout the next couple of weeks, but that within 2 weeks we would expect to see the impact of those measures. We would need to hold those measures in place for some time to make sure we continue to reduce that likelihood of spread. How long that is, I know many people want to know, would like a date for when we're going to stop, but really that's going to depend on watching the data closely. One of the things that is a bit different for us than other places in the world where you probably coming from outside and those where it's transmitting in the province. And I'm working with our team, our epidemiology team, to try to have a clear distinction between those two groups, because it's that second group that will really tell us about the success of our measures. Having increased numbers of cases in returning travelers, really our measures are only meant to stop those individuals from spreading further, but they won't reduce the number of cases in returning travelers.
Excellent. And one more question, please, operator.
Next question comes from Madeline Smith of the Calgary Herald. Your line is open.
Hi there. I apologize if I missed this, but I'm just wondering, you said the numbers of community transmission are still relatively low, given the percentages of other cases. Do you have a precise number for how many at this point are coming from community transmission?
So at the current time, my understanding is that we have approximately 6. Again, we're still investigating some of those. So this is a number that isn't firm, but it looks like we have about 6 kind of split between Calgary and Edmonton. And I anticipate that I'll have more information tomorrow after the public health investigation has had a bit more of a chance to determine if we're concluding that these are community or not. But there are 6 that we're concerned about at this time, and I'll have more information tomorrow.
Excellent.
I think she got it.
Perfect. Dylan?
I got 2 questions. First one's for Dr. Hinshaw. You spoke about the need to increase testing earlier. We saw that there were a couple of different sites rolled out here in Edmonton as well as in Calgary, I believe. How has that rollout been? Has there been any kinks, or has it been pretty smooth?
So I don't have information. I don't know, Dr. Jaffe, do you know about the assessment center rollout, the expansion? I haven't heard any concerns voiced. I don't know. Do you have any more?
So thank you. We have 3 assessment centers open and operating here in Edmonton. A second center has opened in Calgary. There are 2 in the central zone, and the strategy is a little bit different in the south and the north. The assessment centers are busy, as you would expect, but aside from that, no, I have not heard any specific concerns.
You said you had a follow-up?
Yeah, this one's for Dr. Jaffe as well. You spoke about doctor burnout and the fact that we're clearing out some of those non-urgent surgeries. I guess, is this testing the capacity of Alberta hospitals, and are we concerned that there may be further doctor burnout? I mean, we hear that it maybe take 2 weeks just to see if our measures are working. Is there a concern that we might have over burnout on doctors?
So I don't think I said anything about doctor burnout, so I want to be clear about that. For sure, we are concerned about all of our staff. This is not just doctors. This will be all healthcare professionals. This is going to be a strain for all Albertans, and it's going to be a strain for healthcare providers. This is something that we work for, that we train for. Certainly this is going to stretch us. There's no question about that. We are planning. We are preparing. We are, in fact, in discussions with recently retired physicians, nurses, and other healthcare workers. In fact, they're contacting us. They want to come back to work. They want to help. So we're in the process of working with those individuals so that we can get them back into the workforce. It certainly will be a concern as things get busier and busier. There's no question this will be a strain on our system. But again, we are preparing for that, and we're going to do absolutely everything we can to support the wonderful women and men who work for Alberta Health Services and throughout the health system.
I've got a question for Dr. Hinshaw. We keep talking about this is the new normal. I'm just curious, when can we expect life to go back to the true normal? You know, when is this expected to peak? Do you guys have some sort of timeline or estimate in mind? Or
So we know some things from past examples, past pandemics, and we'd be making predictions based on that past experience, knowing that this is the first time in recorded history that we've had a coronavirus pandemic. So we're making inferences from what we've seen in influenza pandemics, which I think is reasonable. There's similarities in some of the mechanisms of spread, but again, knowing that we can't make perfect predictions. So in past pandemics, what we've seen, and I'll even use the 2009 pandemic, which most people will remember, we did have a surge of cases in the spring, in sort of April and May, and then over the summer we saw the transmission go to a pretty low level. And in the fall we had what was called the second wave, where we had an increase in the number of cases again, and that second wave was much higher than that first in the spring. So one of the things that we're mindful of is that the measures we're taking now are appropriate. We do need to contain the spread at this time, and we also need to prepare for what's in store in the fall. I think that in the next several months, obviously we'll be watching closely the effects of these measures. We can't sustain all of these measures for months on end. Some of them we may be able to sustain for longer than others, but we'll just need to be watching really closely the effect of these measures, spreading out that transmission over the summer. Perhaps, if this is the same as previous pandemics, we may be able to ease off a little bit, but we'll need to be ready in the fall for the possibility that it could come back again and have plans to deal with it at that point.
is that because of the warmer and colder weather in the seasons? Or?
So again, for influenza, the virus doesn't survive as long on surfaces when it's humid and warmer. It tends to survive longer in cooler and drier. And in the winter, we also tend to be more closely packed in inside environments. And in the summer, often we're more outside, kind of keeping windows open. And also then the virus doesn't survive quite as long. So those are some of the things for influenza, and we'll be watching to see if coronavirus reacts the same way.
We'll go to the phone and then we'll come back to the room, guys. Operator, could you patch through the first question?
The next question comes from Robert Tuttle of Bloomberg. Your line is open.
Yes, you mentioned work camps, I think. What specific measures can they do given that you have without probably more than 50 people in these camps, eating in dining halls and whatnot?
Yeah, so that's a good question. And again, the more than 50 people, the concern is really if they're in any one given space. So certainly the dining halls are an example of that. And what measures can be taken, whether it's that kind of setting, whether it's in a dormitory setting, are similar measures to what we're suggesting here. So any kind of distancing that can be employed. So if smaller groups of people can eat maybe in shifts, if they can be seated a little bit further apart, making sure that there's a check at the door to see if anyone who's coming in has any kind of symptoms of a cough, fever, or maybe mild cold-like symptoms, and then asking them to not eat in that big setting. So all of those measures are things that can be taken in any setting. And again, we are making some of these exceptions because there are essential services that do need to continue. And so we are making some of these exceptions to allow that to happen.
Operator, could you patch through another question?
The next question comes from Shane Bosing of Everything GP. Your line is open.
Dr. Hinshaw, are you able to confirm if there's been any more cases in the North Zone?
So there are currently a total of 3 cases in the North Zone. And I know there's been interest in exactly where those cases are. So we are working to get a map on our website that will show the cases by the local geographic area. And so hopefully, I'm looking at my comms team, will that be up later today?
Within 24 hours.
Within 24 hours, we'll have that up, so you'll be able to see those locations within that local geographic area level.
Excellent. Can we pass through one more question on the phone, and then we'll come to the last 2 in the room?
Next question comes from Jennifer Lee of CBC. Your line is open.
Hi, Dr. Hinshaw. I actually have 2 questions, so maybe I can just state them both right off the top. Can you give us a breakdown of the age range? So how many are children, how many are seniors, that kind of thing? And then my second question is, given the 2-week incubation period that you referred to earlier that everybody's been watching, and the developments that we've seen in recent days, how are you feeling personally about our ability to flatten this curve, to really contain this? Like, what are you feeling about that?
So the first question about breakdown by ages. So we'll have this, I believe, also on our website very soon, if it's not already there. But we have the majority of our cases are in an age range between 25 and 79. So we have, I could read all of these, but again, you can go to the website and get specifics. But under age 25, we really only have a small number of cases. So within each of the five-year age spans between ages 1 to 4, 5 to 9, 10 to 14, 15 to 19, we have between 3 and 5 in each of those age ranges. So I think if you want the specifics of each of those 5-year age groups, you can see that on our website. Again, within the next 24 hours, that will be up. Then with respect to the question of how do I feel about our ability to flatten the curve, I feel that we are taking these aggressive measures at the right time. So we know in other places they've waited to take aggressive containment measures until they've started to see more widespread community transmission. When we look at our testing data, and we have been doing community testing for the last 10 days since we started ramping up our enhanced traveler testing, so we've been doing both at the same time. I think it is a good sign that we've only detected a small handful, but having detected that small handful, now is the time to take these measures to make sure that we put in place what we need to do to flatten the curve before it's too late. So I am hopeful and optimistic that these measures we're taking will take the effect that we want them to.
All right, final two. We'll go Dean and then
I don't know if you can answer this one, but probably a lot of people wondering if they should be canceling weddings in May and June, other events, reunions and stuff. Any guidance you can give on that?
I guess I would just say that I was talking to my family about a reunion plan for the summer and already saying, I don't know, should we have contingency plans? It's really hard to predict. As I said earlier, it is possible that we might be able to ease back a bit, but we don't know for sure. So I think in the meantime, I guess each person will have to decide how much risk they want to take. But certainly at the moment, we're saying that smaller gatherings can go ahead. So maybe it's an opportunity to have a smaller gathering rather than a larger one.
Excellent. Julia?
This is probably a question for Dr. Jaffe. We're hearing that assessment centers are packed to the brim at this point because they're so busy and there isn't that room for social distancing between people. What do you have to say about that, and what can be done about that?
So the assessment centers, as I mentioned earlier, certainly are busy. I actually specifically asked a question about that just a couple of days ago to ensure that the care that we're providing and the assessments we're providing are safe and that social distancing is maintained. I was assured that although they are busy, they are working hard to ensure that proper hygiene is maintained, hand hygiene in particular, cleaning of spaces when people have been there, and that they're doing their very utmost to maintain social distancing. That will be an ongoing challenge, and they will continue to do their very best. And of course, as the need arises, we will be looking at whether we do need to find different or new spaces for assessment centers.
Just quickly to follow up on that, we're also hearing that some paramedics are going to do these in-home tests, but they don't have the proper masks to be doing them. Do we have enough masks for all these frontline workers?
So I have not heard that. What is required to perform a nasopharyngeal swab is a surgical or a procedure mask. We certainly have a very large supply of surgical and procedure masks, so that should not be a challenge.
Thanks. Final question?
I believe this is for Dr. Hinshaw. Just yesterday, certain government Alberta employees got a directive to come into work today. I understand that's since been reversed. Just what would you recommend for not only government Alberta, but other institutions and employee offices, how they should be handling this situation?
So I think any organization, especially organizations that provide critical services to the people of Alberta, need to consider how they're going to be able to continue to provide those services. And so each organization, again, is going to be slightly different in terms of options that they may have to continue to provide those services. And so, as I've said before, with respect to the businesses in the province, in terms of what planning they need to do, first of all, what kinds of risks their employees might have and how they protect their employees from the risks. Second, how do they minimize the spread of virus in their workplace, whatever that workplace setting might be? And third is that business continuity piece. So I think as long as employers are thinking about how do they limit the risk to their employees, how do they limit the risk of spreading in the workplace as appropriate to that context, and how do they make sure that critical, essential parts of their business continue, that's really guidance that any organization would be well positioned to take. And if you have specific questions about the government policies, that's best directed to the Public Services Commission.
Thanks for coming, guys. We will give another update tomorrow afternoon. Thank you.
Thank you.